Welcome back. I'm nurse educator Chelsea, and today we're going to be talking about delegation. It can be really difficult for new nurses to determine what tasks can be delegated to assistive personnel. Assistive personnel often have the job titles of nursing assistant, nurse tech, or patient care assistant. There are other titles that are used, but these are the most common that I've come across in my nursing career. Scope of practice for these positions can vary by state and facility, so just be sure to check your local regulations and your facility policies before determining what tasks you are going to delegate. Assistive personnel that perform a task outside of their scope of practice can face disciplinary action. The nurse that delegates a task that is outside of their scope of practice can also face disciplinary action. Commonly delegated tasks can include checking vital signs, including temperature, heart rate, blood pressure, pulse oximetry, and respiratory rate. Assistive personnel can also commonly check blood sugars and toilet patients, which can include ambulating them to the bathroom, using a bedpan or a bedside commode, and sometimes performing incontinence care. They can also assist in performing activities of daily living, or ADLs, which can include oral care, denture care, bathing, linen changes, and ambulating stable patients. In my personal experience, nursing assistants can also empty drainage bags, which can include JP drains, Foley bags, or ostomy bags. Assistive personnel can also call a rapid response. In most facilities, anyone, including visitors, can call a rapid response. In some places, assistive personnel can perform more invasive tasks, such as removing IVs or removing Foley catheters. But before delegating these tasks, make sure to check your facility policy to make sure this is within their scope of practice. And just keep in mind, just because a nursing assistant or assistive personnel can perform a task, doesn't mean it needs to be them to perform the task. Nurses can perform all the same tasks that a nursing assistant can do. This might sound like common sense, but in my nursing career, I have met nurses that once they became a nurse, they felt that they did not need to perform the tasks of a nursing assistant or assistive personnel. This is particularly applicable when your nursing assistant is not readily available, or if you do not have a nursing assistant for your shift. As a nurse, you still can get vital signs. You can still toilet a patient, including performing incontinence care. You can still help with activities of daily living, and you can still help feed patients. It is a pet peeve of mine to see a nurse go find a nursing assistant or assistive personnel to go delegate a task when the nurse was already with the patient and available to complete the task. We all just need to work together to do what is best for our patients. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.